Thank you very much, ladies and gentlemen, colleagues and delegates. My name is Dr. Oniyire Adetiloye. I'm from Nigeria. I work for an organization called JAPIGO, which is affiliated to Johns Hopkins program. This presentation was made in one of the work I did on our projects. And the title is the use of integrated supportive supervision visits to strengthen family planning service delivery in two selected states of Nigeria. Yes. So next slide, please. I want to move to the next slide.
You can use the downward arrow to move the slide.
Okay. So thank you very much. On this presentation, the partners that we work together are a conglomerate of partners like the Federal Ministry of Health, specifically the Family Health Department. We also work with the State Ministry of Health. This project was implemented in two states, Ebonyi and Kogi specifically. So the two state Ministry of Health were involved. And we also work in selecting facility from 88 facilities that cut across general hospital and primary health centers. Now let me explain. Hospitals in Nigeria are tiered along three tiers. We have the tertiary institution, we have the general hospital and the primary health center. The general hospital are the second level facility care. They also take referral, and the primary health center are the one that are the closest to the people. So we took a sample from 88, 44 of them are general hospital and 44 are primary health center. We also work with the National Primary Healthcare Development Agency. This is an agency that take care of the primary healthcare services and primary healthcare center. We also work with their state counterparts, which is the state's primary healthcare development agency. We have some implementing partners that were also working in the state where we work, like the Clinton Health Access Initiative and some other partners. So I'm trying to move the slide. Okay. Yeah. Thank you. Thank you very much. So on the background of this presentation, just to give you a little bit background, that family health services, family planning services in Nigeria is not a top notch. There's a huge challenge with the family planning services provision in Nigeria, but the government of Nigeria is trying all its effort to ensure that women of reproductive age have access to contraceptive, healthy timing and spacing for pregnancy, so as to reduce the huge burden of unmet family planning needs. The government has also invested a lot of money. At a time they were committing to the tune of $3 million for procurement of family planning commodities. This is to ensure that women of reproductive age has free access to family planning services that are free, so that they can reduce the CPR that is hugely high in Nigeria. So they also engagement and capacity building for service providers to be able to provide services, especially family planning services that are of the range of long-acting contraceptive, the use of long-acting contraceptive methods to ensure that women have access. So they've built capacity and they have documents that can enhance this capacity. So the background is also for country of Nigeria to try and improve the contraceptive prevalence rate, which is abysmally low for now. We want to move our contraceptive prevalence rate from 11% to 36% by 2018. However, we're not sure that this is done. We are not sure that the family planning services that are being provided by family planning providers are top-notch, that the quality of those services can be improved. So in improving the quality of services, we were using integrated approach, what we call integrated supportive supervision, to ensure that where people that have been trained to provide family planning services can also provide quality services and ensure that women and children, women of reproductive age do have access to family planning services. Yes, I'm trying to move. Okay, I'm trying to move to the next slide. Seem to have issue with this. Okay, sorry, yeah. So the aim of this study, the objective basically is to assess how we can use the integrated supportive supervision to help in solving and improving the quality of family planning services that are provided in those selected facilities. I've mentioned that we selected 44 general hospital and 44 primary health center. And specifically, the study was to answer this question: can we use the integrated supportive supervision visit that is put in place as a platform to improve quality of family planning services that is being provided by this healthcare facility? So let me explain a little. There's an approach called integrated supportive supervision, whereby healthcare workers with the Ministry of Health staff and program staff go to selected facility and do what we call integrated supportive supervision, looking at what healthcare workers are doing, all the services they are providing, and ensuring that those services are of utmost quality. But, so a tool was developed by the Federal Ministry of Health, and that was universally accepted in the country to be used for the supportive supervision. But what happened in most of this time is that because it's a team that go to this facility to do supervision, they sometimes don't really focus on family planning as a program. So we use this study to kind of hone down on the family planning aspects and to see whether carrying out integrated supportive supervision by this group, how can it help to answer, can it actually improve the quality of family planning services that are being provided by these healthcare workers. So what we did basically was to pick representative from representative from the Federal Ministry of Health, from the State Ministry of Health, and from our program to carry out supportive supervision, and supportive supervisions were done in those 88 selected facilities. And what we were assessing is the competency and the proficiency in the delivery of family planning services. And then before this was done, the group that were selected to do this supportive supervision were actually trained for 4 days so that they are very familiar with the checklist to be used, and for them to ensure that they are able to monitor the quality of family planning services, as well as the knowledge and skills of this healthcare provider that are providing these services. So this was done over a number of days after the training, and then we group them into teams, and then they move into the field to actually use the tool to collate and collect some of the data that that the integrated supportive supervision tool, like I said, was designed and developed by the Federal Ministry of Health with the support of partners and all the stakeholders. And this was adapted, and it was a tool that was generally used. This was used to determine the overall of the performance of the delivery of family planning services, including other services. But what we did was basically to focus on the family planning piece to ensure whether this integrated supportive supervision will be able to improve the quality of family planning services that were conducted in those provided in those facilities. 2 rounds of ISS, which is integrated supportive supervision visits, were conducted at 2 different times at 6-month interval. We did the baseline, and then 6 months after, we went again to collect this data. Collecting this data over this period, we were able to now triangulate the data and then come up with this result and summary. So in summary, what we came up with, after analyzing the data, we look at the demographic of the service provider. We recognize that the data came out to be that we look at the age of the provider. It shows that most of the providers that were spoken to at those facilities, about 12% of them are actually below the age of 30. So 30 to 39 age were consisted about 16% of these cohorts. 40 to 49 age consisted about 34%, and some of them were about 50 years of age. So the mean age of the provider in this facility was 44.6, roughly 45 years of age. We also looked at the medical qualification of this provider, because at facility level, depending on the level of the facility where you work, in general hospital, you tend to find more nurses, nurse midwives. Some are single trained nurse that are providing family planning services. But when you move to the primary health center, the bulk of the staff are the community health extension workers. These are also another cadre of healthcare workers in Nigeria. They are trained in School of Health Technology. So these are the bulk you find in the primary health centers. So, so we look at their qualification. We found out that 2.6% of these cohorts were CHU, community health extension workers, and then 18% or thereabouts were nurse. They have nurse midwifery training, and then they have nursing training, and then nurse with midwifery training constitute the bulk, about 68%. Some of them are midwife only. They didn't go through nursing, because in Nigeria you can do nursing, you can do midwifery separately, but some are combined. They do nursing and midwifery. And other cadres that were not categorized were about 1.4%. So we also looked at the year of experience. How experienced are these workers? How long have they been working in this facility? We realized that less than 5 years. Some of them have worked for less than 5, about 10%. 5 to 10, about 6%.
Excuse me, Mr. Dr. Oniyire, your time's up. You please try to complete your presentation in 2 to 3 minutes of time.
Oh, sorry about that. I didn't know about the time. And then the year of working in family planning, some of them have worked over 3 years, some have worked over 3.5 years. So this is just to show the categories of people that have worked in this facility. Profile of the family planning provider. Some of them have been trained. They are well trained. They've undergone family planning training. They have attended the skill core training. So what we found at the end of the day at round 1 and round 2, the result came out to be that the average score in terms of knowledge and skills in round 1 was triangulated around 5. They were able to score 5 of the total of 15 competency based in that ISS tool. At round 2, that moved to, at the second phase, 6 months after, it moved to around 11%. So there's increase in number of family planning, method of acceptance as it rolled by. So what this shows basically for us is that the service delivery points in terms of the reporting, in terms of the developing their action plan, in terms of incorporating family planning use methods, improve over time as this provider progress. So the lessons learned for us is that integrated supportive supervision is a major strategy that can help to remove bottlenecks to program achieving desired goals and objectives. That healthcare worker performance quality improve with mentorship and supervision, as well as provide the needed motivation and encouragement. We also, in conclusion, we can conclude with this study that the feedback we got from the first round of ISS was used by the service provider to plan to improve performance. And then it's also concluded that it can be assumed that supervisor can use this tool to enhance the quality of family planning services, output, and service delivery process. ISS can boost the confidence of provider and trust that will improve quality of services provided. ISS tool is also very sensitive to track increase in new method acceptor, knowledge, and commodity of stocks. Thank you very much for listening.
Thank you so much, Dr. Oniyire.